Welcome to my final year project presentation. My name is Nilam Farhana binti Aziz, a final year student in Bachelor of Science Management Mathematics. The title of my FYP is Selecting the Effective Ways to Prevent COVID-19 from Spreading Using Fuzzy AHP Method. I am supervised by Sir Muhammad Fazrul Izhar Muhammad Idris. COVID-19 spread has resulted in numerous economic and social damage. Malaysia is one of the countries that were affected badly by COVID-19. The coronavirus spreads directly from one person to another person. The case of COVID-19 still increases each day rapidly in Malaysia, even though the government has already taken many actions to prevent the virus from spreading. This study aims to select effective ways to prevent COVID-19 in Malaysia using the fuzzy analytic hierarchy process. An analytical study was conducted between 3 decision makers, which are a nurse, a medical officer, and a medical assistant to determine the impact of this preventive measure. The fuzzy AHP method was used to select the effective ways to prevent COVID-19 from spreading. The findings of this study show hygiene are important to prevent the spreading of COVID-19. Wearing a mask can help prevent the virus from spreading to others. Then, after touching public objects, always wash or sanitize your hands and cover cough and sneezes. Background of the study. Based on a study by Pazos, the first cases were discovered in Wuhan, Hubei province when employees at the Huanan wholesale seafood market, which sold seafood, poultry and birds, became ill with mysterious pneumonia, once again linking wild animal markets to SARS. Then, China notified the World Health Organization about the sequence of incidents for the first time on December 31, 2019, 23 days after the first patient sought medical treatment. In Malaysia, the first coronavirus cases were confirmed among 3 Chinese nationals who were quarantined at Sungai Buloh Hospital. The 3 were among 8 Chinese nationals who were quarantined in a hotel in Johor Bahru. Problem statement. The case of COVID-19 still increases each day rapidly in Malaysia, even though the government has already taken many actions to prevent the virus from spreading. Lockdown measures were deemed necessary to halt the spread of the virus as rapid human-to-human transmission occurred, and much about the virus remained unknown. Because the movement control order was not predicted, it raises concern about Malaysian knowledge of COVID-19 and their views toward it. Objective of the study. The main objective of this study is to select effective ways to prevent COVID-19 in Malaysia by using the fuzzy AHP method. To implement the main objective, several sub-objectives are carried out, such as to identify the prevention strategies that have been implemented in Malaysia, and to study in depth function of fuzzy AHP in performing the selection method. Scope of the study. The study focused on preventing COVID-19 in Malaysia, which will be conducted using fuzzy AHP. Then, the study involved 3 experts active in activities related to COVID-19 as the decision makers. Significance of the study. The study can provide which prevention methods are effective using fuzzy AHP. Then, the study can identify the strategies that the Malaysian government conduct to reduce the spreading of COVID-19. Finally, the study also helps to reduce the spreading of COVID-19 in Malaysia because this research figures out the best prevention ways that all Malaysians and the world can practice. Preventive action in Malaysia. Shah et al. Conducted a study about actions taken by the Malaysian government towards the COVID-19 outbreak in Malaysia. After the first case outside China was reported in Thailand, the authors stated Malaysia implemented a strict screening mechanism at all airports. To break the COVID-19 chain, the Malaysian government implemented a movement control order on March 18, 2020. Previous study on fuzzy AHP method. IHAN researched a fuzzy analytic hierarchy approach for supplier selection problems in Jomoto company. Companies can save money on materials and gain a competitive advantage by selecting the best supplier. As a solution, the supplier selection problem can be solved using fuzzy AHP, a commonly utilized multi-criteria decision-making technique. Previous study on prevention strategies using fuzzy technique. Gore et al. Researched identifying dominant risk factors involved in the spread of COVID-19 using hesitant fuzzy MCDM methodology. The study aimed to rank and analyze the risk factors involved in COVID-19's dissemination. The study is analyzed using the fuzzy analytic hierarchy process to identify the biggest risk factor. In contrast, the which were determined using hesitant fuzzy sets, and the technique for order preference by similarity to ideal solution. Method of fuzzy AHP. In this study, fuzzy AHP will select effective ways to prevent COVID-19 from spreading. The relative relevance weights for the criteria in this study are estimated using Buckle's approach. Several steps in the techniques are as follows. Step 1. The criteria or alternative are compared by decision maker using linguistic terms indicated in Table 3.1. The pairwise contribution metric is illustrated in equation 1, where D denotes the K, the preference of the decision maker, for the I criterion over the J criterion expressed as fuzzy triangular numbers. Step 2. Check the consistency ratio. The consistency of an evaluation was examined using the formula to ensure the expert's consistency judgment. Step 3. If there are many DM, the preference of each DKIJ are averaged, while Dij is determined as in equation 4. Step 4. As indicated in equation 5, the pairwise contribution matrix is updated based on average preferences. Step 5. Buckle states that the geometric mean of each criterion's fuzzy comparison values is obtained as stated in equation 6. Here Ri stands for triangular values in this case. Step 6. By adding the next three substage to equation 7, the fuzzy weight of each criterion may be found. Step 7. Wi must be defuzzified using the center of area method because they are still fuzzy triangular number, equation 8. Step 8. Mi is not a fuzzy number, nevertheless, it must be normalized using equation 9. Application of fuzzy AHP on COVID-19 prevention strategies. The main criteria for selecting prevention strategies are social, physical, health monitoring, unnecessary touching things, hygiene, immunity fitness, healthy diet, and sharing personal items. 3 professionals in the field, including a nurse from Klinik Batu 10 Lekir, a medical officer from Kementerian Kesihatan Malaysia, and a medical assistant from Hospital Jelebu were surveyed. This strategy is used to gauge the criteria employed in this selection procedure. As a result, hygiene has the highest normalized relative wage value of 0.311 according to the table. This number indicates that H has the biggest contribution in selecting effective ways to prevent COVID-19 from spreading. As we know, wearing a mask is mandatory for everyone when doing outdoor activities. Wearing a mask can prevent transferring the virus to another person. Then, always wash or sanitize hands after touching public things and cover cough and sneezes. The second higher normalization relative wage is social physical, which is 0.228. Therefore, a movement control order was required when the COVID-19 infection rate reached a critical level. Furthermore, avoiding crowded places and practicing 1 meter social distancing can prevent COVID-19 from spreading. Health monitor is the third higher, which is 0.183. Before entering public places such as supermarket, restaurants, and malls, screening temperature is required. Anyone who has had close contact with someone who has COVID-19 should be quarantined for 14 days after their last exposure. Vaccination is one of the methods to boost our antibodies. In Malaysia, there are 79.8% had been completed first dose and 78.7% completed second dose. When a large portion of a community becomes immune to a disease transmission from person to person becomes unlikely. As a result, the entire community, not just individuals who are immune, is protected. Conclusion. Based on the result from this study, we can conclude that hygiene is the most important in selecting the effective ways to prevent COVID-19 from spreading, which are wearing a mask, hand wash or sanitizer, and cover cough and sneezes. Moreover, social, physical, and health monitor also important in preventing COVID-19 from spreading. The importance of each of the key prevention strategies have been ranked. Recommendation. In future studies to assess the spread of coronavirus, many more preventive measures, as well as different decision-making methodologies, may be studied. For example, technique for order of preference by similarity to ideal solution, elimination and choice expressing reality, preference ranking organization, method for enrichment evaluation, decision-making trial and evaluation laboratory, analytic network process, and etc. can be other methods to be applied in this study. So, that's all for my final year project presentation. Thank you.